50% of our portfolio is allocated to life science investing. And if you look at life science investing and you look at Asia, then clearly India is a place that offers opportunities the like of which probably don't exist anywhere else. So when I joined, we had offices just in Copenhagen, Boston, and San Francisco. And today we're in Singapore, Shanghai, Mumbai, London, Copenhagen, Boston, and San Francisco. We also felt that certain manufacturing competencies are very advanced here, and so we recently made an investment in Shot Poonawalla, as you well know, which is a pharmaceutical packaging company. AI-enabled X-ray diagnostic imaging based out of India. So not surprisingly, I would say that healthcare IT, health tech out of India is proving to be very competitive on an international basis.
What if I told you some of the world's biggest investment firms are quietly turning India's healthcare system into a billion-dollar business battlefield? Hi, this is Indranil and welcome to the Spotlight Media and Technology. And today's story is about Kerala, a state once celebrated as India's healthcare success story, now becoming the center of a global private equity gold rush. In just the last few years, investment giants like Blackstone and KKR have poured nearly $1 billion into hospitals across Kerala, and they are only getting started. Why? Because investors are looking at Kerala and seeing something incredibly valuable: an aging population, rising chronic illness, millions of health-conscious citizens, and a powerful NRI economy willing to spend heavily on private healthcare. To global funds, this is not just healthcare anymore. It's a high-growth industry with predictable long-term demand. Think about the numbers. Nearly 94% of medically certified deaths in Kerala are now linked to non-communicable diseases like diabetes, cancer, and heart disease. More than 40% of deaths occur among people above 70 years of age. And despite Kerala's strong public healthcare reputation, most patients still depend on private hospitals. That means one thing for investors: the demand for healthcare is becoming recession-proof. So what's the strategy? Buy hospitals, expand aggressively, add more beds, invest in high-margin specialties like oncology and cardiac care, build premium healthcare networks, then scale fast across India. And that's exactly what is happening. Hospital chains backed by private equity are now expanding into Tamil Nadu, Karnataka, Telangana, Andhra Pradesh, creating massive healthcare empires across South India. But there's where the story becomes controversial. Many independent hospitals built over decades by doctors and local communities are struggling to survive because they simply cannot compete with billion-dollar capital. A corporate-backed hospital can buy robotic surgery systems, advanced AI diagnostics, luxury infrastructure, and attract top specialties with massive salaries. Smaller hospitals, they are getting squeezed out, and critics are sounding the alarm because when healthcare becomes an investment product, profit expectations rise. Some experts fear this would eventually lead to high treatment costs, staff reductions, pressure on doctors, and healthcare becoming less accessible for ordinary families. In fact, studies in the United States have already raised concerns about what happens after private equity takes over hospitals: higher operational pressure, rising costs, and questions around patient outcomes. Now India may be entering the same era, and Kerala is becoming the testing ground. This is no longer just a healthcare story. It's a story about capitalism, demographics, aging societies, global finance, and the future of human survival itself. Will private equity modernize Indian healthcare and make it world-class? Or will hospitals slowly transform into corporate machines where treatment becomes secondary to financial returns? The answer could reshape the future of healthcare for more than 1 billion people. Follow the Spotlight Beyond Profession because the most important global business stories today are no longer just about technology or finance. They are about who controls healthcare, data, and human life itself. Thank you very much for watching and signing it off.